Well, thank you for staying with us. This morning, our next conversation is around the Association of Nigeria Physicians in America, ANPA. They're here to talk about their ongoing 6th annual ANPA week, which is taking place in Edo State. Quite a packed one here. Professor Christopher Okosheri is ANPA president. He joins us this morning. Thanks for joining us. Okay. We also have Dr. Chinyere Anyogu Eziri, who is ANPA president-elect, as well as Her Excellency Mrs. Betsy Obaseki, First Lady, Edo State, and Dr. Clifford Eke, who is ANPA treasurer and co-chairman ANPA's Missions Committee. Quite a packed one we have this morning. Thank you all for joining us. Well, perhaps we want to begin.
Actually, Dr. AK is probably going to join later because I think he's in surgery. So the other three people are the First Lady, Professor Konseri, and who is the president, and then Dr. Chinyere Anyogu Eziri, who is the president-elect.
Okay.
So those are the three now on the Zoom right now.
Okay. Well, perhaps you want to start us off by at least letting us know exactly what we are dealing with here. What is ANPA's mission? I know it's a medical mission you're talking about, but a number of people will be wondering what ANPA is about.
ANPA stands for the Association of Nigerian Physicians in the Americas, and I will let our president, Professor Konseri, give you a general overview.
Okay.
So let him do that. President Konseri, you want to come in?
Well, the baton is handed to you, President Konseri. Okay, I understand that they're not ready. Well, I guess.
Okay.
So
okay, that's fine. That's fine. ANPA is a 501c3 non-profit organization, which is...
Sorry, what was that you said?
A 501c3 registered. That's a charitable non-profit organization. Okay. 501c3 in the U.S. context is what you call non-governmental, non-charitable, organization. Okay. So our job is actually to look after the interests of physicians in America who are of Nigerian origin, and we represent about 5,000 doctors out there. And what we do is to bring a collegiate body together that would look after the interests of Nigerians and how we can give back to Nigeria. And our vision and mission basically is a healthier Nigeria in a healthier world. And that's why we do these annual missions, to make sure that we give back.
Okay. When you come every year, is there any particular area of medicine that you concentrate on?
We actually do every specialty, medical and surgical, because we not only want to serve, we also want to build capacity by working with our colleagues here. So we learn from them and they learn from us for the benefit of the patient. And we try to go to all the 6 geopolitical zones of the country.
Where did you go last year? Remind us.
Last year we went to Calabar, but it was virtual.
Okay.
We wanted to do it actually in 2020, but COVID wouldn't let us. So we decided we're going to do it virtual in 2021. And the First Lady, the former First Lady of that state hosted us, Her Excellency Onare Duke.
How did it go?
No.
There was
not last year. Former. Okay.
Yes.
Okay.
How did that go?
It went very well, even though it was virtual, but some of the surgeons were working with the local surgeons virtually through telemedicine, and some of the physicians were working virtually with the physicians here virtually. But some of our people came on ground to do training for basic life support and advanced cardiac life support, and train the local people so they can train other people. Yeah, so it went well.
How much impact is this mission having on healthcare in Nigeria?
I would say considerable impact because we have three arms to the mission. We have medical mission where we do hands-on. We have CPD, which is continuous professional development, where we talk and train in the universities. And we have advocacy where we go to Abuja to meet with the legislature. And this time we met with the vice president. So we want to, in fact, to deal with policy. We want to also to give back in terms of clinical, and we all want to also help in terms of education.
How easy is this mission for you, considering that Nigerian doctors are leaving, and one of the main reasons they give for leaving is lack of the wherewithal to perform optimally?
That's a good question. It's very important to us, and that's one of the questions that was raised when we met with the vice president during the week. And that's why we need to interact more with our local colleagues here, so we can share knowledge, we can share equipment, we can share expertise, and so that will make them feel more comfortable doing what they can do here, instead of wanting to emigrate from the country.
Well, thank you. Well, let me ask Professor Okonseri. Well, we've had this overview from Doctor in the studio with us now, but in terms of this year's experience, what are the expectations? What are the things that people should expect from this ANPA week?
State, Professor Obey Akori, who is also with us here joining this forum. So back to your question, in terms of expectation, I would say the following. I would expect the citizens of Edo State, as many as possible who have access to us today, that they would get, at the minimum, a consult from both members of ANPA who are volunteering and the local, or rather our colleagues who are on ground, at least a consult to start with, because without the consultation you don't get to make a diagnosis, neither do you get to do treatment. So at the least I would expect from us is at least for the patients to get experience that they will get consultation from colleagues and from those of us with diaspora at this point.
Okay. Dr. Anyogu Eziri, can I ask you, what is, well, we know the general thing to expect. What are the peculiarities? I ask because the last time it was in Calabar, but this time it's in Edo State. What makes it peculiar this year?
Well,
Doctor, that's for Dr. Chinyere Anyogu Eziri.
if I may deflect the question to the Honorable Commissioner at this point, if you don't mind, Anyogu might not be on this call right away. Okay. So the Commissioner can please chime in.
Okay, we'll come back to you later in the studio, but let me come back to you here, sir. So generally, the ANPA has always sought to exchange information. Essentially, that's what you have talked about here now. What are some of the things that have been learned over the years with ANPA every year?
In terms of what we learn, or in terms of what the people we're interacting with learn, or the people we're delivering?
What you have been able to come up with, and how it's useful over the years, for which reason it's been sustained.
We have found out that there's tremendous need for this kind of thing, actually, on an ongoing, continuous basis for continuity of care. And that is why this year we actually partnered strongly with the Edo State government at the highest level. And our sincere thanks are to His Excellency the Governor and the First Lady for making it happen, because over the years as we came, we saw that we will come, we will do these surgeries, we will do these consults, we will leave. and our colleagues have to take care of the rest of it because we're not here and we can't be here. But now we are partnering with them to establish a one-year project of telemedicine where what we have left, they will still be taking care of it while we continue the dialogue virtually, so that if it's hands-on, we can do it together. If it's consultation cognitively, we can do it together. And even when we are gone, we are still working. That's what we have come up with, and that's one good lesson that we have learned.
When did the mission arrive in Nigeria?
Mission arrived, it started on the 22nd of April, and we will wrap up on the 4th of May, but it's usually a week, so we're wrapping up actually officially. Yes, we're wrapping up officially this weekend, but because the surgery is so much, the need is so much to dovetail back to your question, we decided that we will do the cleanup while our colleagues take over as we wrap up towards next week.
She's back.
Okay. Well, let's go to her, President. So, what makes it peculiar this year?
In terms of peculiarity, the first thing is...
No, I'm asking Dr. Chinyere Anyogo-Eziri, the President-elect. My apologies.
Maybe...
Okay. Well, we'll get to you. I understand that there are some. Okay, well, this is not telemedicine. This is just telebroadcasting.
Yes, yes, I hear you. Actually, the Commissioner for Health, Professor Akori, can answer that question.
Okay.
What is specific or special about this one? She can answer that because that's part of the innovation we brought in, learning from our previous. Yes, so maybe Professor Okore can take
we'll come back to Professor Okore.
Okay.
Let's. You want to take the First Lady on?
Yes. The First Lady. I believe she's with us now. There she is.
Okay.
Good morning, and thank you for joining us. Now, you have been working with ANPA since they arrived in Nigeria. From what you have seen, in what areas was there a lot of need, higher need?
Well, usually these patients come with a lot of eye patients requiring intervention. So that's what we've experienced here in Edo State, the need for eye care. Yes, eyes.
Eye care, okay, all right.
Eye surgeries and prescriptions for glasses and all that. We've had thousands of patients requiring that on this mission.
Okay, that's interesting. And I don't know, since you've been working with them since they came back, what are some of the peculiarities that you have seen? We'll still come to the question the question of what makes these years unique. But what for you are some of the peculiarities that you have seen in the experience you've had with them so far? That's for you, ma'am, First Lady. Go ahead. I can't hear you. I think the...
Good morning, everyone.
Okay. Go ahead. We can hear you.
Yeah.
I believe that's the Commissioner for Health.
Yes.
Okay, go ahead.
Peculiarities from my perspective, I would like to start from the preparation phase, where I have seen someone in the position of our First Lady so engrossed in the preparation phase. I officially am the LOC chair, but in practice, she did quite a lot more than I did, being physically present at meetings, not in the State House, but in the Ministry of Health. For me, that was humbling and very challenging. And we had this bonding with the diaspora team, because apart from the scores of meetings that we had virtually and physically, we had several meetings with the diaspora team, and it was just like one big family preparing for one big event that all of us were determined to see would work and work excellently. I've been involved in medical missions for 2 decades now. I've never seen any like this one. And then when it came to implementation, there were many unique points about this Edo State Government ANPA Medical Mission of 2022. For starters, this is the first time ANPA, and I believe any other big organization of this type, will be partnering with the state government to deliver this kind of free medical mission in this scope. Secondly, this is also the first time ANPA or any other body I know will be providing this service using government-owned primary healthcare centers, and several of them at the same time. We had a 3-week pre-screening period to screen patients in preparation for surgery, and of course, other patients came, eye patients, medical patients. We started with 3 PHCs at Sapler Road, Ubo, and Oedo. That's Oedo is Sapler Road. We started with 3 PHCs, and then we had to scale to Edo North, 2 additional PHCs in Edo North, Edo Central, and then we had to extend in Benin City to Bekun and Lucky Way. On the whole, we used 6 PHCs in the state. Something else that was very, very touching, very humbling, and in fact phenomenal in my view, was the disappearance of the hitherto artificial boundaries between healthcare practitioners in medicine, in nursing, in laboratory science, optometry, ophthalmology, surgery. The boundaries just disappeared. I saw it was like a mass action. It was as though there was a galvanizing force, an impetus I couldn't understand, propelling everyone in the same direction. And it didn't matter whether you were from the primary level of care as an expert, or the secondary level of care, or the tertiary. We all just blended together. The CMD of UBTH, CMD of ISTH, neuropsychiatric hospital, working together, planning together, delivering the service together. It was simply phenomenal. You want me to go on?
No. I know that if we let you go, if we let you be, we will have you're a professor, so we will be expecting a lecture as a result of that. But just as we have been told, there are 3 major components to this. Let me go back to, I understand that Dr. AK has also since joined us. Good. Okay, I understand that he's gone off. So let me go back to President-elect. Earlier we were asking all kinds of questions about the peculiarities and the whole philosophy surrounding this whole intervention. We understand that there are 3 major components to the ANPA medical mission. I don't know if you want to take us through that one. We understand there is a medical mission, there's continuous professional development, and there is advocacy. Can you take us through the ropes about that one?
So thank you very much. I will take the question on behalf of the President-elect at this point, who is not on the studio. Okay. But basically, it's an ANPA week. And the 3 components of the ANPA week are pretty much the service provision, which goes all through the specialties in medicine, including dentistry. And the second component is the advocacy. The advocacy requires us to go to, the federal government. This time around, we were able to speak with the Vice President on 3 priority areas. The first was the budget. The country's budget for health is abysmal. We are 3%. Based on standards from the United Nations, from WHO, we are really nowhere. We asked for an increase, and we did not only ask for an increase, we suggested possible sources that this money could be attracted from, because all we hear, no money. And we made a suggestion to the Vice President. We talked about brain drain, and again, brain drain and medical tourism. We suggested what could be done to address brain drain, medical tourism, and reverse it to brain gain. 3 areas: policy, program, and systems. If you are able to develop programs, which you are ready to provide in more details about policy initiatives that could be put together by the federal and state government, We talked about programs. Think about it. Let's give you a very simple example about a program. If you allow consultants or attendants from the United States to join the colleagues out here, the rest assured there's going to be opportunities for cross-disciplinary approach to managing patients. There's going to be improvement in care. They're not going to leave their jobs in America, but they can come in during their holidays to take up cases that they could interact with their colleagues here and address. Then look at the other piece about systems. We have the capacity to develop systems that would help reduce medical tourism, help reduce brain drain, and reverse it as brain gain. Think about it. A year ago, we had virtual medical mission. In the virtual medical mission, we were able to provide care with the help of our colleagues. That is almost brain gain. We are providing care through virtual means, and patients are benefiting from this process.
Okay. Well, thank you very much for that, Doc. But let me ask, just before I come back to the studio, let me ask Her Excellency. You know, it's one thing to come up with all of these initiatives for people. It's another thing altogether for how the people will receive it. Well, we understand from what the Commissioner has said that you've been involved, what's the word now? Hands-on on this project. That's most gratifying. But what are some of the, should I say, eye-opening revelations you have had in the process of being a part of this project?
Well, I've got to learn a bit more about medicine in the course of meeting with medical doctors and all of that. I've also seen that indeed, like we all know, there's a need for primary health care to be taken on very seriously by government, both the state and federal levels. This mission essentially is for people who can't afford decent medical care on their own. It's not for the rich. So that's the whole reason why it's all arranged around the primary health centers. And so I've seen thousands of people come out from the villages and urban areas to access this opportunity and get expert medical care with the mission. And it's been gratifying because I've been to, I go to different centers to see what's happening since the mission commenced. And seeing people kneeling down and holding my leg to thank me for the comfort and care.
Okay. Well.
And the component of telemedicine is another thing that I'd like to talk about. Yeah. I believe it's the first time it's happening with ANPA, and they told us so, like Dr. Chris explained earlier. Even after the mission ends, the plan is ANPA has gracious enough to adopt 2 primary health centers in Edo State to use as pilot for the telemedicine scheme. It's been tested. I had a discussion with the provost of the School of Nursing, who incidentally happens to be American trained. It's a newly established or newly refurbished and established School of Medicine here in Edo State. And she was a telemedicine champion with this mission and was related with the doctor on the other side in America. They've done 20 patients so far using the telemedicine component. And she was telling me how very impressed she was with it and how smooth and successful it's been. And so that's the platform they're going to use moving forward as the mission ends. So continue to consult with patients here. I mean, over there in America, doctors will keep on consultations with simple, ordinary patients who go to primary health centers. This isn't happening at the UBTH and the specialist hospital level. It's happening at the the very bottom of medical care here in the state, and that's the biggest benefit, to me, the biggest innovation that's happening now with this mission. I believe it's something that's we're hoping would continue, hoping that after successfully deploying this to primary health centers, the mission will keep adopting more, and government will also do more to get more primary health centers key into this telemedicine platform. And that will provide medical experts, expensive medical care free from the US to Edo citizens, which means Edo citizens at the masses level would have access to specialist care from America. That, to me, is the most phenomenal element and development with this mission.
Excellency, how much awareness went into this before the mission actually arrived? Because you mentioned earlier that a lot of people have turned up to be treated by ANPA.
Yeah, so we spent a period of about a whole month to begin to sensitize Edo people across the state. We have a formidable media team that works on that. The LOC had different subcommittees, and one was the media committee that handled that, and we came out with jingles in the various ethnic languages across the state, and in Pidgin English and English, proper English. And it was out on television, radio, social media. We also had town criers in the local government areas go around with megaphones and informing people of the upcoming mission. We had a plan to first get people who would require surgical intervention to come out and register. And so we could prepare them, the team could prepare them for surgery, because they don't just appear in the hospital today and expect to be operated upon immediately. Doctors have to carry out other vital tests and all that to be sure that we will be able to safe and prepared for the surgery. So we had all of that done. The government arranged for free testings and blood testings and radiology tests and all of that, free to all patients across the state. And so we spent the last 1 month prior to the mission having patients across the state carry out tests and all of that, and now prepared them we wanted all of that done before the mission. The doctors arrived in America, so because they had said to us, as soon as they land here, they want to start work. Okay. So they had to line up all the patients, prepare them for surgery before the doctors arrived, and indeed, as soon as they came in, and we had a opening ceremony, they went straight into the theaters and began to operate. Some of them had started operating prior to the opening ceremony in the morning. Okay. And then when the mission started, the other patients who were in just medical care began to appear and are being treated. And we've had them. The first day I went around and counted 1,700 patients altogether in the first day from 3 locations alone. So we've had it's widely advertised, and people are generally aware of this mission.
Well, so much to unpack in all that we have heard so far, but a quick one with you, Dr. Shimbali.
Yes.
Telemedicine.
Yes.
It's definitely innovative. I'll be honest, I've been hearing it for 20, 30 years or thereabout. Institutionalizing it now, what are the challenges you see? And in 30 seconds, what are the challenges you see, and how do we get around it?
Internet bandwidth. That's a major problem. You could see what we just went through now. The audio was in and out. Mm-hmm. With telemedicine, we'll be hearing them and be seeing them and be instructing the patient and the provider. Doctor. So if the bandwidth is not good enough, it's not going to be very clear on what you're trying to show or what you're trying to hear. But hopefully, we will be able to get good bandwidth because the Edo State government has invested very well into that. So our test run was initially shaky, but by the time we got to the second and third day of the mission, we were able to get things going. And as the First Lady said, we've seen 10 patients who have chronic medical issues that need to be followed. and diabetes, hypertension, kidney disease. There's even dialysis going on, peritoneal, and we want to go into the high-tech one, hemodialysis. And as the thing progresses, we'll work with our colleagues here into kidney transplantation and all that.
We have to thank you very much.
Quickly, where's the mission going next year?
Next year we are going southeast, because Edo is south, so we are going southeast, and it's still to be determined, but it's southeast.
Okay.
All right. Now that that cat is out, we have to thank you. We have to thank you very much, Dr. Abraham Osimbali, Chairman, ANPA's Advocacy Committee. Thank you so much for
Thank you very much. And
as well as
the
panel, yes, in Edo State, Her Excellency, Mrs. Betsy Obaseki, First Lady in the state. Thank you so much for your time, as well as Professor Christopher Okusheri, President of ANPA. We have also had with us this morning Professor Obehi Akoria, who is Commissioner for Health in Edo State. Thank you, ladies and gentlemen, for being there. Thank you.
Thank you.
Thank you.
All right. The sunrise continues in a moment. I don't know what my producer has in mind because we have quite some time. We'll be back.